Coronavirus continues to spread around the world. We are now nearing 13 million confirmed cases globally, with more than 3.3 million of those cases in the US alone. Companies and scientists are racing to develop a vaccine. And just this morning, we learned that Pfizer and BioNTech have been granted FDA fast track designation for 2 vaccine candidates. But moving too quickly could come at a price. Joining us now is Dr. Dara Kass, Yahoo medical contributor and Columbia University associate professor of emergency medicine. Good morning to you, doctor. First off, let's start with this news we're hearing out of the FDA this morning. What does it mean for a potential vaccine, the fact that these companies have been granted this status?
I just think that it means that they're optimistic that this is going to be a vaccine that's worth getting into the next stage trials. Remembering that these stages of trials, phase 1, phase 2, phase 3, usually take months to years. So we actually are seeing a huge number of vaccine candidates be fast-tracked, whether in name or in practice, because we're seeing multiple candidates over a disease we've only known for really 6 to 8 months. Really get into, we have multiple candidates in phase 3 trials now. We've talked about this candidate before. It was announced last week that they had some optimistic numbers about producing a vaccine candidate in 2021 in the multiple millions of doses. So again, I think that this is good that they are investing in the idea that this candidate could be viable. But again, we don't have any good data yet on this vaccine getting into the arms of people who are now exposed to this virus.
These potential early vaccine candidates, Dr. Kass, is it safe for people to take them in the early going?
So like everything with the evolving science, remembering that we don't know very much about this virus and we're working as fast as humanly possible, we do need to be cautious and respect the virus in the process, in addition to actually getting these candidates out as fast as possible. We can't say vaccine trials are inherently experimental. So to proclaim that they are entirely safe isn't necessarily accurate, but they are done with rigor and consistency to minimize the risk to the test subjects. But yes, test subjects that take these vaccines early are joining the scientific process and putting themselves at slightly higher risk early on in the process.
You know, doctor, we've seen in the past vaccines to fight other diseases, other viruses. We've seen that sometimes when these vaccines are given to people, and they're generally given to people who are healthy, right? They don't have the virus yet. We've seen that these people have come down with an even more serious case of that particular virus. I know it's early, but has early testing of these vaccines for COVID-19 shown that to be the case?
No, we have not seen any side effects or any adverse effects yet of this vaccine in any of these trials that are coming out, mostly because they're not in human trials really yet. There's a few that are in early trials, but you have to see those effects happen over days, weeks, months, and years. Remembering that vaccines are safe when they come to market, and that is because of the process we have in place keeping them safe. It is important that we respect the process of developing safe vaccines, and that we understand that vaccination has saved countless millions of lives in this world, and we need billions even, and we need to make sure that we are excited about a vaccine process, but we don't rush it too fast to get to an easy answer when the hard work is really just masking up, washing our hands, and staying apart for now.
Dr. Kass, I think a lot of people are waking this morning to see a good stat out of New York City. No new deaths over the weekend. What is the city doing right? I'm in the city. I see crowds. I see people out at bars. I see people still walking outside without a mask. But what's happening in the city?
So I think that this is a reflection of the months of work of New York City residents in masking, really staying home when it was necessary, keeping apart from each other to keep the virus down. And now even when they gather, and maybe they're not acting perfectly all the time, but I will tell you, Brian, I see a lot of people wearing masks when they're walking. I see less people on the street than I normally would. And I know that people are still taking this virus seriously. We know that New York City got the viral load, really the background noise of this virus, I like to say, down to a very low level, so that even when we had the protests, for those people that weren't wearing masks, they still didn't seem to get infected. So this is a really good example of what we need to be doing to open schools. We need to get communities down to viral loads that are low enough that we can start moving around each other safely. And if everybody is not acting perfectly, if everybody is not wearing a mask, if everyone's not totally social distancing, there's still some room. But that doesn't happen when your virus is hitting, tens of thousands of cases a day, and your positive test rate is at north of 20%, like we're seeing in Florida right now.
Doctor, as far as I know, there's no vaccine for SARS, which is a respiratory disease that we saw over a decade ago. If that turns out to be the case here, if there just turns out to be no vaccine for COVID-19, how do we manage this disease and get back to normal?
So I actually think that that's what we're showing the rest of the country in New York, right? We are working towards our evolving economy. We're talking about opening up our schools in a new way while we're working towards getting a vaccine and really understanding a little bit more about how to treat this virus. There are a lot of viruses we don't have a vaccine for, but we have treatments, early testing and identification. We've talked about a bunch of ways that we can get out of this, whether it's vaccinations, therapeutics, or diagnostics. And remembering that early testing and keeping people isolated so they don't spread the virus would really help our communities get back to work without a vaccine or even more advanced therapeutics.
All right, Dr. Dara Kass, we can go on, but thanks so much for being with us. We'll see you soon.
See you soon.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.